Hello, my name is Nina Khalida from NPM 3023, and today I'm going to explain about the Moye's mixed dentition analysis. Okay, so what is Moye's mixed dentition analysis? So this is a method developed by Dr. Robert E. Moye's, and it is widely used in orthodontics. And the main goal is to predict the size of permanent canines and premolars before they erupt. We usually use this analysis during the mixed dentition phase, which is when both baby teeth and adult teeth are present in the mouth, and typically between age 6 and 12. And the purpose of the analysis is to estimate the mesiodistal width of the unerupted teeth using just the measurement of the lower four permanent incisors. Then we compare the value to a prediction table to find out whether there is enough space in the dental arc, and this helps us catch early problems like crowding or spacing issues, so we can plan early orthodontic treatment if needed. And now let's talk about the advantages of Moye's analysis. First, it is known to be very reliable with very little chance of systematic error. One great thing is that it can be done just as well by a beginner as by an expert. So it's very user-friendly. It is also quick to perform, which is helpful in a busy clinical setting. Another benefit is that it doesn't require any special instrument, just a simple caliper to measure the teeth. Even better, the analysis can be done directly in the mouth without needing radiographs or lab work. And lastly, Moye's analysis is versatile since it works for both the upper and lower dental arcs. In Moye's analysis, we use the mandibular incisors to make the predictions. Why? First, because they erupt early, so they're usually already present when space analysis is needed. Second, their shape and position make them easy to measure accurately with a caliper. They also sit right in the middle of where most crowding or spacing problems occur, so it making them a key reference point. And the most importantly, the size of this four incisor can be used to predict the size of both the upper and the lower unerupted canines and premolars, making the analysis both simple and powerful. The Moyers developed prediction tables derived from the extensive statistical studies on various populations, and these tables provide the predicted sum of the widths of the permanent canine and two premolars in one quadrant. So based on the cumulative width of the four mandibular permanent incisor. The table typically offer prediction at different probability levels. For example, 50%, 75%, or 95%, and it allows the clinician to choose a confidence level. The 75th percentile is commonly used, which means there is a 75% chance that the actual combined width will be equal to or less than the predicted value. Steps for performing Moyer's analysis. So first, measure the mandibular incisor. So accurately measure the gluteus mesiodistal width from front to back, the dimension of each of the four erupted permanent mandibular incisor, central and lateral incisor, and sum this for measurement, and this sum is your predictor value for entering the Moye's prediction tables. Second is consult Moye's prediction tables. So locate the sum of the foremandibular incisors in the prediction table and then read across to the chosen percentile for both the maxilla and the mandible, and the values obtained will be the predicted sum of the permanent canine and two premolars for one quadrant of that arc. And the third is the calculate arc space available. So measure the existing arc space from the mesial surface of the permanent first molar on the side to the mesial surface of the permanent first molar on the opposite side, passing over the primary molars and canine, and this segment of the arc is known as the E space, primary second molar space, and the leeway space, the primary first molar space. It representing the space occupied by the primary canine and first and also second molars, and alternatively measure from the mesial of the first permanent molar to the distal of the lateral incisor on each side, then sum these distances. The fourth is calculate arc space required. This is the sum of the predicted widths of the permanent canine and two premolars for both sides of the arc. For example, if the table predicts 21.0 millimeter for one quadrant, it can be maxilla or mandible, the total space required for that arc would be 21.0 millimeter equal 42 millimeter, and add the measured width of the 4 permanent incisors to the predicted width of the 6 posterior teeth. And then the last is determine space discrepancy. So subtract the arc space required from the arc space available, and then a positive value indicates the excess space, and the negative value indicates a space deficiency or crowding, and a value close to 0 suggests adequate space. Although Moye's analysis is a useful tool, it does have some limitations. So first, it was developed using data from a specific population, mainly Caucasian children, so it may not be as accurate for patients from other ethnic backgrounds. And it also relies completely on the measurement of the mandibular incisor, which means if those teeth are unusually small or large, the prediction might not be accurate. Another downside of is that it doesn't consider tooth angulation or rotation. So if the incisors are twisted or tilted, the measurement might be off. And lastly, the analysis doesn't take into account the overall arc form, which is an important factor in space management. And so that's all for me. Thank you for your attention.